The Dymicron Triadyme C is a two-piece articulating artificial cervical disc prosthesis designed to replace a damaged or degenerative intervertebral disc. Its articulating mechanism consists of three mated spherical lobes and pockets mimicking natural spinal kinematics with physiologically coupled motions. Sintered polycrystalline diamond-bearing surfaces endorse low-friction articulation of the implant components. Implanted through a standard anterior cervical approach, it achieves initial fixation with dual keels and a rough titanium plasma coating at the implant-bone interface. Long-term biological fixation is achieved through osseointegration with this coating. A straightforward surgical technique and intuitive instrumentation enable efficient and reproducible implantation results. X-ray verification should be conducted of the affected vertebral level preoperatively in order to qualify the patient for the Triadyme C device. Particular care should be taken with regard to the different sizes of device available. Place the patient in the supine neck-neutral position. The posterior part of the neck is supported by a soft neck roll to establish and maintain proper lordosis and support. Based on surgeon preference incision, the affected segment is approached through an avascular dissection plane and medial retraction of the strap muscle, trachea and esophagus, and lateral retraction of the carotid sheath. Remove the intervertebral disc material and cartilage to the posterior disc space. By way of using fluoroscopy in the anterior-posterior direction, use this guidance to mark the midline and the surgical level. Sizing of the correct Triadyme C implant is done by the trial implant, chosen by way of patient's anatomy and estimated implant height. The trial implants have various color coding that is based on the various footprint sizes. Insert the instrument into the disc space by using light mallet tapping. The implant center should be aligned with the lateral midline. The optimal trial position respects a zone of not more than 2 mm posterior or anterior. The whole of the trial implant facilitates verification of the trial's position and rotation. If the trial implant is loose or can be removed too easily, the next larger height should be selected. Select the chisel instrument that corresponds to the size of the selected Triadyme C implant. Under fluoroscopic guidance and with light hammer tapping, progress the chisel into the vertebral space. Once the appropriate depth has been reached, confirmed by fluoroscope, draw the chisel instrument back out of the vertebral space using the slap hammer included in the instrument kit. Select the appropriate sized Triadyme C corresponding to the size of the selected trial. Open the sterile barrier protecting the device and connect the universal handle to the plastic implant holder. Once the handle is pressed entirely against the back of the tool head, it must be rotated 90 degrees until the thumb spring snaps into place. Use the mallet to apply slight tapering onto the implant handle to insert the Triadyme C with light hammering force. Once the device has reached the appropriate depth, draw the inserter instrument back out of the vertebral space. The Triadyme C will disconnect from the inserter instrument automatically, remaining in place as the instrument is withdrawn. Use lateral fluoroscopy to confirm correct position of the prosthesis. If the Triadyme C is not driven into a sufficient depth, the TAMP should be placed against the implant and lightly struck in order to drive the entire device deeper into the intervertebral space. In case of necessary revision or implant replacement, use the extractor as follows. Position the small osteotomes on the two halves of the extractor between the faces of the device and the superior and inferior vertebrae. Fit the two halves of the extractor together. Tighten the two small hex screws on the back of the instrument until the osteotomes hook onto the keels of the Triadyme C. Use the slab hammer to extract it. Remove the Casper distractor and unscrew the distractor pins. Confirm proper implant positioning both in lateral as well as in AP fluoroscopy. Close the wound following standard practices.